My name is Marta Filipa. I've been working as a dentist for 18 years now, and I've treated more than 5,000 patients. I'm a member of the International Organization of Dental Lasers, also the ITI, which is the biggest organization in implantology.
Ever wondered what patients usually ask the most? We sat down with one of Budapest's top dentists to break down the 6 most common dental implant questions patients ask.
Basically, my clinic, which I have founded in 2007, we have altogether treated more than 18,000 patients. My team and I can solve almost any problem in dentistry, and we are focusing on the high quality because that's what we believe in. So that's why I did 3 Master of Science courses. The first one is in lasers in dentistry. The second one is about dental surgery and implantology. And the third one is in periodontology. And all of them I've done in Germany. Of course, I'm a member of the International Organization of Dental Lasers, also the ITI, which is the biggest organization in implantology, the Hungarian Dental Chamber. These are the organizations taking part of, and basically I do visit all the big congresses of regarding periodontology and osteology and all what's very important for our patients in order to treat them with an up-to-date procedures.
What is really implants and when are they required by a patient?
Basically, implants are always required when teeth are missing or teeth are in a very bad condition. And what I think is that now it's very, very popular, this all-on-4 concept, which I would like to say that it is only durable and long-lasting if you are not making a fixed prosthesis on the top of 4 implants, but only you place a removable one, which only patient can remove, but basically patient can eat with it and do everything. It won't come out of the mouth, and basically it will last longer because patient can easily clean it. So that's what I think about 4 implant. Of course, if there is enough bone and possibility for bone grafting, we place 6 implants, and on 6 implant, of course, we can place a completely fixed prosthesis. But a very big challenge for the patient is to clean it. So that's the main factor why patients are mostly deciding regarding 4 implants, a supported removable denture. But we do also the fixed ones, but we remind them that they have to come at least once a year for cleaning and to unscrew the whole prosthesis and then to clean it professionally and then putting it back. If it does not happen, we won't give any guarantee for this type of prosthesis. I think it's understandable.
If you can share with us all the types of implant procedures you offer.
As I said, on 4 implants, we do the removable prosthesis. On 6 implants, we do the fixed prosthesis. And of course, we do single implants with single crowns, and we do small implant bridges as well. There is 1 tooth missing in between 2 implants, so it's a 3-unit bridge on top of 2 implants. Basically, these are the most common procedures we do with implants.
How do you decide if a patient requires all-on-4 versus all-on-6?
First of all, the patient need and the patient will is which has to be considered, and then we tell the patient what is the positive and negative effect of having either this or that. We tell them what we can do and what we cannot or will not do. Maybe we could, and many other dentists would, but we don't because of our peace of mind.
Apart from the bone level of the patient, are there any other criteria that would not make them a good candidate for dental implants?
Basically, bone level is just one of the factors. We need bone height and bone width. And also we need mouth without inflammation completely. And we need a patient who is not smoking. Even if the patient is smoking, then we agree on that, okay, in the first 2 weeks after implantation, you will not smoke. And then after, maybe you can turn back to your smoking, because wound healing is so much affected by smoking. Also, if patient is having the possibility to come more times, then that's the better, because then both patient and we can be more relaxed in the whole treatment procedure.
If you can also share with us the implant brands that you work with at the clinic.
I started to place implants long time ago. First, I placed Noble Biocare, and then I turned to Stroman, and also I did Alpha Bio. But about 10 years ago, I've changed to BTI, which is a Spanish implant brand, and it's basically very much based on biology and literature and common sense, which means that it really absorbs blood compared to any other implant system, which is the main factor of having bone around implants. So that's why we use BTI implants exclusively since 10 years, because the biointegration of these implants are way superior to the other brands. And it's not only proved by the literature made by the BTI Technology Institute, but also there are independent studies which are having these results. And also BTI has got PRGF endoret system, which is like the cell-blood membrane system, the PRP, so-called PRP, and we use it at every implant procedure and also on those aesthetic gum surgeries and all these. And also, of course, when we extract teeth, basically the plasma, and there are the platelets, and from the platelets all the growth factors are coming, and nice fibrin is there, so we use that in our procedures in order to quicken up and also to support the healing, which is in this way a lot beneficial for us when we have to bone graft or do something like that.
How do you provide warranties for implant procedures?
If there is no bone, then we make the bone. And after making the bone, we place the implant. And then we try to load the implants in a correct way. And then we ask the patient for them to come back yearly. And if there is no nice attached gum around the implant, then we do the touched gum surgery as well, in order to have everywhere that nice attached gum which they can clean very easily. And these are all the factors we need in order to have the guarantee. For the screws, basically we give a lifetime guarantee if all these things are done by us and also by the patient. So it's only 30% on us and the rest is on the patient, unfortunately. But we like to place our implants in mouths where we know it's going to be taken care of.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.